Hello, everybody. I am thrilled to be joined by Dr. Amy Petty. My name is Ken Rubin. I'm one of the founders and the CEO of Elite Medical Prep. Amy is one of the company's most experienced and successful tutors and also course instructors. We are here today to talk about the newest NBMEs released for Step 1 several months ago, and the detailed analysis that we did of these exams in order to provide our students with better understanding and to better determine the predictive value of these NBMEs for real Step 1 performance, given the fact that we are in the first cycle of their use. Amy is going to be leading the discussion of these NBMEs and the results of our study. I will play the role of the questioner and prompt hopefully useful discussion for anybody listening to this presentation.
Hello, everybody. Like Ken said, my name is Amy Petty, and I am a senior tutor at Elite Medical Prep. I'm very excited to be sharing the data that we have recently gathered from studying all the Step 1 NBMEs as well as UL self-assessment exams. So I'll be sharing some of these data today. And so let's go ahead and get started. Okay, so the why we did this analysis, I think this is part of a bigger effort to really better understand all of these NBME practice exams as well as self-assessments, and to see, if there's a trend there we're observing, or if there's any specific questions that we're seeing, so we can better advise our students going forward. And some of the specific questions that we are hoping to answer are one, are the NBME forms and UL self-assessment practice exams equivalent in terms of evaluating student performance over time? And is there a specific form that is harder, or is there a form that is subjectively as well as objectively easier compared to the others? Are the new changes proposed by USMLE Step 1 reflected in these newer NBME forms, which include forms 25, 26, 27, 28, 29, and 30? So these were just released a few months back, and then we're interested in knowing some of these newer questions that may have been released. So some of the methodology that we have used is we had 5 test takers who are experienced tutors, all have more than 2 years of experience tutoring USMLE Step 1 in Elite Medical Prep. And all of these tests were taken in the span about 2 weeks with no additional studying. So we are trying to ensure that there is no significant change in terms of knowledge level in between the tests. And all of them have to be taken under strict testing conditions, no open books, within the time given by NBMEs or UL self-assessment. All of these test takers will asked to submit a survey in terms of their subjective evaluations of the difficulty level of each of these tests, and all of these were blinded. And the final analysis was done by me and also independently verified by another senior tutor at the company, and who also happens to be another MD PhD from the same school that I graduated from. So let's get into some of the data. I think everyone is excited to see what we find.
Hey, Amy, to point out one more really important feature of the methodology, just to emphasize what you mentioned about no studying in between these test forms. This is really useful because all the data that we have as a company from all of our students who've taken these NBMEs and other forms over the years, that data is useful up to a point, because presumably the student is studying throughout their study period and they're gaining knowledge, gaining experience, and so they're not the same test taker each time they take the exam. Medical schools, and we know there may be learning advisors and other medical school administrators watching this video, medical schools also can gather a lot of data from their own students about NBME performance and perhaps UL self-assessment performance, but again, you run into the same issue, because unless you have your students take all 6 forms consecutively, your students are going to be taking these tests at different stages in their preparation, and therefore there should be an upward trajectory of scores, and you're not able to interpret how similar these forms are. And it wouldn't be ethical, really, to have your students take, or any students take, all the forms at once, because that would be diminishing the utility and that would not be conducive to their studying. So the fact that we're able to have experienced test takers who are not altering their knowledge from test to test over the 2 weeks of this study was very, very useful, as we'll see in the data.
Absolutely, I totally agree. And I think, that the reason we designed it this way really is to kind of test the equivalent, it's like how equivalent are these tests in evaluating student performance? The data we have gathered from our own students may be better at, using them to predict like which test is the most predictive for, their actual performance on the USMLE Step 1 exam. But what we're doing here is really kind of aiming at testing equivalence. So yeah, absolutely. Okay, let's move ahead with the data. First slide is actually showing you the box and whisker plot of all the NBME new forms. So these are 25 to 30. So on the y-axis is score and then each of the form, and the line represents the median score of all the test takers. So you can see that there is a statistically insignificant p-value, which means that just by doing a ANOVA test across all the tests, there is no statistically significant difference in terms of how each of these test takers score on these NBME forms. And then the average actually for all of these tests is around about 236 to 242. So all of them were pretty equivalent to each other. However, we also recently completed additional studies, including the UWorld self-assessment exams in UWorld self-assessment 1 and 2. So as you can see that by including UWorld self-assessments 1 and 2, we now have a statistically significant p-value, which means that by adding these two tests, they are, significantly different from the NBME practice exams. And by just looking at a median, again, it's about 20 points higher for UWorld self-assessment 1 compared to all the NBME forms. Oh, not sure why this slide changed. And then UWorld self-assessment 2 is about at the same level, but is still a few points higher than the NBME forms as well. And if you look at the individual score trend, you can see that for each of the test takers, they're shown in colors and average is shown in black. It's pretty consistently around the 240 range for all of them. So this is the average score rather than the median score that I was showing earlier. And then right at UWorld self-assessment 1, you have about a 20 points increase in terms of score, and then comes back down to about the 240 plus range for UWorld self-assessment 2. And just to show you a better picture, so this is just the average score for all the test takers. You can see that for NBME practice exams, it's about 240, 20 points increase, drops down at UWorld self-assessment 2.
So Amy, so let's just spend a minute or two on the slide. I think this slide really clearly shows the deviations between the UWorld assessments and the NBMEs, and also looking at the NBMEs, it looks like there's remarkable consistency, which we said at the outset was definitely one of the endpoints we were looking for. How internally consistent are these assessments? And then, so maybe I have a few questions. Maybe one, if you could reiterate why it is so useful to see, based on our study, that the NBMEs are consistent compared to each other. And specifically, you as a very experienced tutor, how could you use that insight in order to advise your students over the course of a study period?
Yeah, that's a great question. And I think, it's useful to me in two ways. One, I always have students coming to me, it's like, oh, is there any preference in which order, I take these NBME practice exams, knowing that they're all pretty equivalent to each other, I can tell them, really, in which order you take, it really doesn't matter. There is not a, like a better or worse curve associated with each of these NBME exam. And two, I think that it really helps me in evaluating students' progress over time. I think that's the more important thing here, because if a student really, for example, from form 25 to 26, increase their score by 10 to 15 points, and knowing that these tests are very equivalent to each other, I tend to trust that increase in score a little bit more because I know that, this increase in performance is due to their, studying and the hard work they put into it, rather than just, one form has a better curve than others.
Yeah, that makes a lot of sense. Also, looking at the UWSA scores, the fact that these NBMEs that we don't really know, even if we can tentatively say that the scores are comparable to each other, we don't really know whether the score level that we see here is predictive of actual step one performance, because we're looking at the first cohort of students who are taking their step one exams. We are recording this video tonight. It's June 22nd on Tuesday. And we know that many of the students that we recently taught in the Mount Sinai Step 1 board review course are taking their Step 1 around now. And many of the tutoring students that our company is working with are also taking the test now. And we're not going to get those results for at least another couple of weeks. And they're in that interim period, there'll be many more students taking their exams. So being able to include the UWorld assessments in our analysis is really useful, because these UWorld assessments have been around for a long time. There have been many generations of medical students who've done UWorld 1 and 2 and then gone on to take their exam, and then were able to compare. So maybe you could talk a little bit about the gap that you've seen, or the predictability you've seen of the UWorld 1 and 2 just over the years from your experience as a tutor, and also what we as a company have found, and how that it could be useful here in terms of assessing how predictive the step one NBME forms are.
Yeah, so I personally found this study to be really useful for me in going forward in advising students, because over the years we have always known that the UWorld self-assessments are less predictive and actually will overestimate student scores for USMLE Step 1. So we have known that going in. So this analysis that we did really just confirmed that suspicion or speculation that we had in our company in the past few years. So we can see that there is 20 points higher in terms of average score from UWorld self-assessment compared to all the NBME forms, even though UWorld self-assessment 2 is less overestimating the score, is still a little bit higher than even the highest NBME form that we're seeing, which is form 25. So for me, I would just tell my students that if you take UWorld self-assessment 1 and you suddenly have like a 20 points score increase, be cautious with that score increase, because I would hate for my student to be like, oh, now I'm at a score range that I'm really happy with, and this is time I go in to take my exam. So I think that will help future tutors and other medical schools and understand the predictability of UWorld self-assessments going forward as well.
Exactly. And just to say it in a similar way, because this is so important, historically, we have seen over prediction from UWorld 1 by about 15 to 20 points. That's been our internal data. That's also been the subjective experience of a lot of our tutors, both for their students and also for themselves, because many of our tutors have themselves taken these exams not that long ago. And this is also correlation data that you'll read about on Reddit, and you'll just kind of hear floating on the internet about 15 to 20 point over prediction. That's exactly the over prediction for UWorld 1 that we found in our study. And Amy, is there any reason to think that this cycle in 2021, that the over prediction of UWorld 1 is somehow different from what it's been in past years?
I do not. I personally don't have any evidence that that in this cycle might be different from the other cycle. And that generally, like you said, it has been the trend that we have observed in the past few years. And just in my personal experience with all of my students, that has been the clear trend that I was seeing as well.
Yeah, I completely agree with that. There's nothing that we've heard, and we have a relationship with UWorld. We know a little bit about their methodology. There's nothing to suggest that they've changed their forms. And so at least at the higher echelons of scoring, it seems like the gap between NBME and UWorld is consistent with what it's been in the past, which is reassuring. Mm-hmm. And Amy, as you said, for UWorld 2, we've always found that UWorld 2 inflates less. There is maybe still a little bit of an inflation, but clearly a lot less than Form 1. That's what we see here. And also anecdotally, what we've heard from many students and tutors over the years, that their final Step 1 score is often somewhere in between their last NBME score and they're the average of their UWorld self-assessments. And so all of what we've seen here is still consistent with historically what's been found.
Yeah, absolutely. Okay. Okay, let's move forward with the data. So there's some more exciting data we will be sharing as well. So again, we also query the average number incorrects in each of the forms. So again, for the NBME forms 25 to 30, it's pretty consistent across the board, but then you start to see a discrepancy in terms of the average number incorrects for UL self-assessment 1, which is again, like almost like 5 to 10 questions lower. UL self-assessment 2, again, is at about at the same level as of all the NBME forms in terms of the number of incorrects. And once we have that data, we actually did analysis to see, how does the number of incorrects correlate to the predicted score. So again, all of these table is just going to tell you that for form 25 to 30, if you can look at just the number of incorrects, for example, 20, if you get 20 questions wrong, you will score about in the 250 range. And then they're all very consistent with each other. However, if you get 20 questions wrong, UL self-assessment, you're automatically going to get like almost a 15 to, like 10 to 15 points increase in terms of score. So that just based on maybe UL self-assessment 1 just had a more generous curve than the NBMEs. UL self-assessment 2, again, is at the same level as all the NBME forms. But if you look at the number of incorrects that with, up to the range of 40 or 45, you can see that they start to get a little bit more generous towards that end in terms of UL self-assessment 2. And also, we asked all the test takers to submit subjective evaluations of each of the forms. Not surprisingly, forms, and again, they're evaluated on a scale 1 to 5, and 1 being the easiest, 5 being the hardest. Again, forms 25 to 30 are pretty consistent across the board with, more tutors probably feel form 28 was really hard for them. But if you look at UL self-assessment 1 and 2, 1 was really easy for pretty much everybody, where 2, actually all the tutors commented the fact that, all the test taker commented on the fact that this is the hardest form out of all the practice exams, even compared to NBMEs.
And Amy, if you could just go back to that slide.
Absolutely.
Normally when one is designing a test, if the questions are subjectively harder, the curve is more lenient, and conversely, if the questions are easier, the curve is stricter. That's in theory, but it's not always borne out. And that seems to be what we're seeing with UWorld-1. And again, this is not new, but just to kind of put this commentary out there in this context, that the questions on UWorld-1 should feel easier to you, and yet the curve doesn't seem to account for that. It's still, it seems to be a very similar curve to the one we have on UWorld-2. The other point that I would make here is, I think what's really interesting, if looking at Form 28, we see that the subjective difficulty, it's a little higher than the other NBMEs, Amy, as you mentioned. You and I were recently advising a student about which form might be best to take a couple of weeks out from a scheduled test date, and which form could be useful for helping to make the decision of whether to keep that date or to push it back to allow for more studying. And maybe you could just comment briefly about how a figure like this helped us give that advice to the student.
Yeah, that's a really great question. I think, if I remember the conversation correctly, we were telling the students that, she was going to take Form 28, and then depending on how how that exam goes for her, whether she's going to push her exam back or not. And we were telling her that if, she takes this really difficult form, that was really difficult for all the experienced tutors at Elite Medical Prep, and not see a score drop, that is actually a really reassuring sign, because this form tests a lot of some of the most difficult topics or concepts that USMLE Step 1 has to offer. So again, we do not know the predictability of all of these NBME forms, but we can comment on the fact that if you take a really difficult form and maintain your score, even though you may feel like, oh, I'm not improving, that may be really a good sign for the students as well.
Absolutely. And I think we found, and maybe this will come up on a future slide, that many of our tutors in the study actually went down to
Mm-hmm.
Form 27 and Form 28. And so, Amy, just like you said, if a student can maintain their score on 28, and even better, if they could go up by a couple of points, that's a great sign that they're still improving. One other subtle point here is the fact that Form 20 feels so difficult, even though the scaling does seem to even out the difficulty at least a little bit more so than what we just said about UWorld 1 and 2. A lot of times students, when a test form is very difficult, get overwhelmed. And even though the curve does adjust in some way, the student just loses confidence and does not do well. And so it kind of affects them psychologically. And those of you who are listening who are studying for Step 1, maybe you've had that experience as well. And so definitely, if you're looking to see whether you're psychologically in shape or near peak shape for Step 1, to take a really difficult form and see how you can handle that over the course of 4 hours can be a really, really good thing to do.
Absolutely. And I may even recommend that students taking this, as their last NBME, again, being the most difficult. If you're up for this form, maybe you're just, and then do well, you may be ready for USMLE Step 1, like Ken said. Okay, and here is just showing the subjective valuation trend for each of the test takers. So again, pretty consistent across NBME forms, and then drops UWSA self-assessment, and almost everybody gave a UWSA self-assessment 2 of 5, except one person. So just goes to tell you that everyone felt UWSA self-assessment 2 was really difficult. Okay, so that concluded sort of the part 1 of all of our data, comparing all the NBME forms as well as UWSA self-assessments. And going forward, some of the data will touch on the fact that, some of the newer forms like NBME 25 to 30 and how they compare to some of the older NBME forms, which is 18, 20 to 24. So, and are they reflecting, all the changes that USMLE Step 1 is proposing going forward? So, so you will see the breakdown number of biostatistic question or biochemistry questions. So we'll present some of that data here. So old forms, again, 18 to 20 to 24, new 25 to 30. So we're seeing a statistically significant difference in terms of the biostatistic questions in the newer forms. You will see about like 2 to 3 questions increase in per form for these newer NBME forms. Yes.
I asked quickly, did we notice any difference in the style or the difficulty of the biostats questions, or was it mostly the number of questions per form?
I would say that it's more of the number of questions. I'm one of the test takers, and I have also had everyone put in comments in terms of, are they seeing any trends or any difference or any strange new questions? And no one has really commented on the fact that the biostats questions are being tested differently. Actually, they have been very consistent across all the forms that we study. So it seems like NBMEs, even USMLE, even though they're increasing the number of biostats questions, they're still testing the same common important high yield topics that we always get tested on USMLE Step 1.
That's great to know. I mean, we know that on Step 2 and Step 3, they're more challenging biostats questions. For example, drug abstracts, those are very common that require a higher level of interpretation. We're not necessarily seeing those on Step 1, but what could be useful here for a student, if you have a study plan for biostats and you're allotted time and you see here that they're actually likely to be more biostats questions, whatever that time is, maybe spend a little more time, maybe do one more UWorld set or another part of an afternoon on biostats. So you want to think about how these different content weightings for the current crop of tests versus past tests, how that might affect the way that you allocate your own time for studying.
Absolutely. Yeah. So we might make some recommendations based on some of these trends that we're seeing, to spend more time on some subjects that they may be neglecting, previously. So yeah, definitely. Okay, so that's for biostatistics, and going forward is biochemistry. So biochemistry is one of the 2 subjects that we're seeing a really significant increase in terms of the number of questions in each of the forms. So again, for the new forms, we're almost seeing like a 2-fold increase in terms of the number of biochemistry questions compared to the older forms. So For, kind of advising my students going forward, I might recommend them spending more time in biochemistry, where I was telling students, so you're shooting for, just 220, 230, maybe biochemistry, and you don't have a lot of time. Biochemistry might be one of the subjects you can forego, but going forward, I may not make the same recommendation just because it's taking up a larger part of the exam.
Oh, and Amy, I think that that's really useful information, because we know that students are always stressed about biochem. We hear this all the time. Oh my God, I did a set of biochem and UWorld and I got them all wrong, or I feel like I didn't know anything, and what do I do? And typically our advice is not to stress out and completely change their study plan and get a 500-page review book or a textbook on biochem. Typically we say we'll focus on the traditional resources, UWorld, first aid, maybe some sketchy. Would you, based on this new focus, would you say keep with that plan and maybe a lot more time, or would you actually suggest that students should seek out more comprehensive resources for biochem?
I think really depends. I think, still for students who are, maybe aiming to pass or just aiming to, to be in the 220 to 240 range, I would say that, just using first aid and then using UWorld to study biochemistry is sufficient. Because even though we're seeing this twofold increase in biochemistry questions, there's still about 15 questions in each of the forms out of a 200 question set, right? So yes, it seems like a lot, but it's still somewhat insignificant, in the grand scheme of things. They're still going to be testing you on, the bread and butter medicine concepts that you are required to know to take care of the patients. So I would say that, if you're, but aiming to 20 or so, pay attention more to questions and first aid, but don't seek out additional resources. But, for my students who are aiming a little bit higher, like 260, 270, maybe at that time, you can add on like one small short resource to kind of, just improve your biochemistry knowledge. But again, I would not add something that is so comprehensive that is going to be so ambitious that you don't have the time to do it during your dedicated study period. Because whenever time you spend on biochem, it's time taken away from studying other subjects. And I would just hate for my students to run into that problem when they're studying for step one.
That's good advice. I think very reassuring to any student who listens to this.
Okay. All right. So biochemistry, very significant increase. Bioethics. So this is interesting because USMLE Step 1 in their announcement is proposing more focus on testing patient interaction, so what we consider bioethics questions. So but we're not actually seeing that trend being reflected in these newer NBMEs. We're actually seeing a decrease. Again, we don't really know what this means. Maybe there's some of these newer NBMEs are just not reflecting that trend yet. But just one thing to kind of keep in mind a little bit. Anatomy. So I mentioned earlier, there are two subjects that we're seeing a really significant increase in terms of number of questions. So biochem is one of them, and the other one is anatomy. Anatomy is another one that we're seeing like a twofold increase in terms of number of questions in each form. So this is actually pretty consistent with what USMLE Step 1 is proposing, because they're testing more basic science concepts. So that includes biochemistry and then anatomy. So, so we're definitely not surprised by this trend going forward. Basic pharm questions. So these questions are pharmacokinetics and pharmacodynamic questions. And we're also seeing a statistically significant increase in terms of the number of questions as well. And then the last thing that we query were the number of experiment-based questions. So these questions are like, they give you an experiment, you have to interpret the data and then select your answers. So we're actually not seeing any changes in the number of these questions. So maybe good news for everyone who may not like these questions very much. So that concludes all the data that we available. And just to kind of summarize into, several take-home points for students who are thinking about taking step 1 in the next few months or the next year. So, one, we found out all the new NBME forms are statistically similar in evaluating performance. However, UL self-assessment 1 can overpredict performance by 15 to 20 points. And subjectively, Form 28 and UL self-assessment 2 felt the hardest to most of the test takers included in this study. And lastly, in terms of testing trends, the newer NBMEs have more questions focusing on biostats, biochemistry, anatomy, as well as basic pharmacology, including pharmacokinetics and dynamics.
Oh, and great. And then Amy, we do also get the question of what order. I know that you alluded to that briefly at the outset. If a student were to ask you, does it matter the order that I take these tests in, and even NBME versus UWorld, not just NBME itself, do you have any advice based on this study?
Yeah, I would say that, like knowing that the NBME forms are comparable to each other, I don't have a strong preference, in, which order, the student takes it. I may try to tell them, save Form 28 until later. So when they're like the most prepared and really close to their exam, if they do well on that exam, then I may feel very confident sending them into their USMLE Step 1 exam. Whereas, I may tell them to save UL self-assessment, put UL self-assessment 1, somewhere in the middle if they feel like they should take it and use that as a practice, but be very cautious in interpreting the result.
Is there any scenario in which you would not recommend that a student does UWorld assessment 2 after 1, given that 2 seems to be more predictive?
I would say that, in my personal experience, sometimes the students can get really stressed out, once they get that really nice boost of score on UL self-assessment 1, and then drops immediately on UL self-assessment 2. So, so I don't generally recommend students taking them back to back like that. So I would just say that, maybe just kind of space them out by several NBMEs so they can get a nice trend going on. So if there's any outlier, we at least know, oh, that's an outlier, not a true data point.
That's really insightful. And although not necessarily specific to the new NBMEs, that's great advice, I think, in general for a student who's trying to organize their sequence, a practice test. So it's very, very helpful. I think that's it. So we're going to wrap this up. Hopefully you guys found this useful for those of you who are in the middle of studying and thinking about how to interpret your tests and what order to take them in. If you have more questions, I don't think we have a slide for this, but if you have more questions, you certainly can reach us at info@elitemedicalprep.com. Can give you more insights about our study and about advice in general for test taking for step 1. And we have a lot of experience working with students over many, many cycles, and we're always happy to share our advice and our insights. And Amy, I'd love to thank you. You have started residency, your PGY 1 year, and so for taking the time both tonight and also all of your great teaching in the recent courses and all of your great tutoring, and really spending all the time leading this study and putting it together and managing it so well. So we really appreciate all this great work, and I know all the students out there listening to this also appreciate the insights that you helped put together.
Yeah, absolutely. It was my pleasure. I really enjoy working with students and have been working with them in the past 4 or 5 years. And I think, this study hopefully will provide more insight to students for years to come, and, and be helpful in their medical journey.
Excellent. Okay. Thank you all again, and happy studying.